Hello, Dr. Earle again. We've talked about major depressive disorder. We've talked about dysthymic disorder, depressive disorder. Now we're going to talk about postpartum depression. Postpartum depression is a type of depression that is usually experienced by women soon after they give birth to their child. 4 weeks, like 4 weeks postpartum of the baby. Symptoms of postpartum depression include fluctuations in mood lability, and preoccupation with the well-being of the infant. The intensity can range from overconcern to delusions. The presence of severe rumination or delusional thoughts about the infant is associated with significantly increased potential harm to the child, to the infant. Postpartum depression can present with or without psychotic symptoms. Infanticide is the most often associated with postpartum psychotic episodes. That is where the mother is thinking that she needs to kill the child. That is usually facilitated by command hallucinations. That is voices in her head telling her what to do, or having delusions that the infant that she just gave birth to is possessed by demons, and needs to be killed, quite frankly. This usually occurs, this aspect of postpartum depression, where it involves psychotic reactions, usually occurs in 1 to 500 or 1 to 1,000 deliveries. So it's not very often, but it is often enough that it is definitely something that we need to pay attention to. The risk of postpartum depression with psychotic features is increased for women with prior postpartum depression episodes. So if they have a postpartum depression episode in one child, they will probably have it in all other children that follow after that one child. There is a 30 to 50% chance that once a woman has had a postpartum depression episode, that she will have another. Also, what puts the baby at risk and puts the mother at risk of having psychotic symptoms is if that mother has any history of a mood disorder, such as bipolar 1 or 2. If they have that, then they're more at risk of having a psychotic break in their postpartum depression. Women with postpartum major depressive disorder often have severe anxiety or even panic attacks. Maternal attitudes can include disinterest in the infant, fearfulness of being alone with the infant, and over-intrusiveness. Having postpartum depression is not the same as baby blues, which occurs in about, maybe 70% of births, where a woman will feel kind of down, after she gives birth, to the infant. And this usually will occur within the first 10 days of postpartum. They're transient and they do not impair functioning. Okay? So that's all I have to say about postpartum depression for now. But if you stay tuned and tune in next week, I will be talking about seasonal affective disorder. Seasonal affective disorder is what we call SAD. That's the acronym for seasonal affective disorder, SAD. So stay tuned for a short explanation of what that is. Okay? I will talk to you next week. Take care. Bye now.